Menopause marks a significant transition in a woman's life. It is defined as the absence of menstrual periods for 12 consecutive months. Post-menopause refers to the time after this milestone. While it is a natural stage, experiencing bleeding after menopause can be concerning. Postmenopausal bleeding, or PMB, is any vaginal bleeding that occurs after a woman has stopped having periods for 12 consecutive months. It is essential to understand that any bleeding after menopause is considered abnormal and requires medical attention. While some causes are benign, others can be more serious. Ignoring PMB is never the answer. Early detection and diagnosis are crucial for effective management and treatment. Your health and well-being are paramount, and addressing any unusual bleeding promptly empowers you to take control of your health. This guide aims to provide you with comprehensive information about postmenopausal bleeding, equipping you with the knowledge and resources to navigate this experience with confidence. Postmenopausal bleeding can stem from various factors. Understanding the potential causes is essential for proper diagnosis and treatment. Let's delve into some of the most common culprits. Atrophic vaginitis. This condition, caused by thinning and inflammation of the vaginal walls due to decreased estrogen, is a frequent cause of PMB. Thinning tissues are more prone to bleeding, especially after intercourse. Polyps. These are benign growths that can develop in the uterus or cervix. They are typically harmless but can sometimes cause bleeding, especially after intercourse or pelvic exams. Hormone therapy. Estrogen therapy, whether systemic or local, can lead to bleeding, especially in the early stages of use. It's crucial to discuss any bleeding episodes with your doctor to determine if adjustments to your therapy are necessary. Less common causes. While less frequent, it's important to be aware of potentially more serious causes of PMB, such as endometrial cancer, uterine cancer, or cervical cancer. Early detection is paramount in these cases, emphasizing the importance of seeking prompt medical attention for any postmenopausal bleeding. While vaginal bleeding is the hallmark of PMB, it's important to pay attention to any other symptoms you may be experiencing. These can provide valuable clues for diagnosis and guide your doctor in determining the underlying cause. Pelvic pain. Pain in the lower abdomen or pelvic region, especially if it's new or unusual, should always be reported. It can be a sign of various conditions, including endometriosis, pelvic inflammatory disease, or fibroids. Unusual vaginal discharge. Changes in vaginal discharge, such as increased volume, unusual color, or foul odor, can indicate infection or other underlying issues. Pain during intercourse. Painful intercourse, also known as dyspareunia, can be a symptom of atrophic vaginitis or other conditions. Don't hesitate to discuss any discomfort with your doctor, as effective treatments are available. Remember, your body communicates through various signs and symptoms. By listening attentively and reporting any changes to your doctor, you actively participate in your health journey, enabling timely diagnosis and appropriate care. Experiencing postmenopausal bleeding can be unsettling, but it's crucial to remember that you're not alone and that help is available. The first step is to schedule an appointment with your gynecologist or primary care physician. During your visit, your doctor will take a detailed medical history, asking about your symptoms, any medications you're taking, and your family history. They will also perform a physical exam, including a pelvic exam, to assess your reproductive organs. To determine the cause of your bleeding, your doctor may recommend one or more of the following tests. Transvaginal ultrasound. This imaging test uses sound waves to create pictures of your uterus, ovaries, and fallopian tubes, helping to identify any abnormalities. Endometrial biopsy. This procedure involves taking a small sample of tissue from the lining of your uterus or endometrium for microscopic examination. It helps rule out endometrial cancer or precancerous cells. Hysteroscopy. This procedure involves inserting a thin lighted tube with a camera into your vagina and cervix to visualize the inside of your uterus. It allows your doctor to examine the lining of your uterus and take biopsies if necessary. These tests, while they might sound intimidating, are essential for accurate diagnosis and appropriate treatment planning. Section 5. Deciphering the results. Understanding your tests. After undergoing medical evaluations and tests, it's natural to feel anxious about the results. Understanding what these results mean can empower you to have informed conversations with your doctor and actively participate in your healthcare decisions. A normal transvaginal ultrasound typically shows a thin endometrial lining, indicating that there are no significant growths or abnormalities in your uterus, ovaries, or fallopian tubes. Similarly, a normal endometrial biopsy result means that no precancerous or cancerous cells were found in the tissue sample. Abnormal results, however, require further investigation. A thickened endometrial lining on an ultrasound, for instance, might prompt your doctor to recommend a hysteroscopy and endometrial biopsy to examine the lining of your uterus more closely and rule out any potential problems. Remember, test results are just one piece of the puzzle. Your doctor will consider your medical history, symptoms, and test results together to arrive at a diagnosis and develop an appropriate treatment plan tailored to your individual needs. Section 6. Hormones and bleeding. The impact of HRT and medications. Hormone replacement therapy, or HRT, is a common treatment for menopausal symptoms, but it can sometimes cause vaginal bleeding. It's essential to understand how HRT can influence bleeding patterns and to discuss any changes with your doctor. Estrogen therapy, a component of HRT, can stimulate the lining of the uterus, potentially leading to breakthrough bleeding or spotting, especially during the first few months of use. If bleeding persists or becomes heavy, your doctor may adjust your HRT regimen or recommend alternative treatment options. Other medications, such as blood thinners or certain herbal supplements, can also increase the risk of bleeding. Be sure to inform your doctor about all medications and supplements you are taking, including over-the-counter products, to avoid potential interactions or complications. Open communication with your healthcare provider is crucial for managing HRT and other medications effectively. By discussing any concerns or changes in your bleeding patterns, you can work together to find the best approach for your individual needs and ensure your overall well-being. Section 7. Emotional well-being, navigating anxiety and uncertainty. Experiencing post-menopausal bleeding can be emotionally challenging, triggering feelings of anxiety, fear, and uncertainty. It's essential to acknowledge and address these emotions as you navigate this experience. Remember that you're not alone. Many women experience PMB at some point, and seeking support from loved ones, friends, or a therapist can provide comfort and reassurance during this time. Sharing your feelings and concerns with others can help alleviate stress and provide a sense of connection and understanding. Practicing self-care is crucial for emotional well-being. Engage in activities that bring you joy and relaxation, such as spending time in nature, pursuing hobbies, or listening to calming music. Prioritizing your mental health is as important as addressing the physical aspects of PMB. Remember that knowledge is power. The more you understand about PMB, its potential causes and treatment options, the more empowered you'll feel to make informed decisions about your health. Section 8. Your health, your hands follow-up and monitoring. Once you've received a diagnosis and treatment plan for postmenopausal bleeding, it's crucial to follow your doctor's recommendations diligently. This includes taking any prescribed medications as directed, attending follow-up appointments, and reporting any changes in your symptoms. Regular pelvic exams and screenings, as recommended by your doctor, are essential for ongoing monitoring and early detection of any potential issues. These exams allow your doctor to assess your reproductive health, identify any changes, and address any concerns promptly. Maintaining open communication with your healthcare provider is paramount. Don't hesitate to reach out with any questions, concerns, or changes in your bleeding patterns. Your doctor is your partner in health, and their expertise and guidance are invaluable throughout your healthcare journey. Remember, your health is your responsibility. By actively participating in your follow-up care and monitoring, you take charge of your well-being and empower yourself to make informed decisions about your body. Section 9. Finding support and empowerment. Navigating the experience of postmenopausal bleeding can feel overwhelming at times, but remember that you're not alone. Numerous resources and support systems are available to provide information, guidance, and emotional support throughout your journey. Trusted medical organizations such as the American College of Obstetricians and Gynecologists, ACOG, and the North American Menopause Society, NAMS, offer a wealth of reliable information on PMB, its causes and treatment options. Support groups, both online and in person, can provide a safe and supportive space to connect with other women who understand what you're going through. Sharing experiences, insights, and coping strategies can be incredibly empowering and reassuring. Remember, seeking support is a sign of strength, not weakness. By reaching out to trusted sources of information and connecting with others, you can navigate this experience with greater confidence and embrace this new chapter of your life with a sense of empowerment and well-being.